A News 8 exclusive. We've been hearing a lot about the difficulty of dealing with mental health disorders ever since the tragedy at Sandy Hook.
And tonight we have a look at some brand new rooms at Hartford Hospital designed to safely meet the medical needs of people who do have mental health issues. News 8's Bob Wilson live in Hartford tonight with our exclusive look. Bob?
In the past, the people with mental health issues would be taken into the ER and they would be put in the same population. A lot of times they need different kinds of care even though they're wounded. Well, now Hartford Hospital is opening up what they're calling the Purple Pods. You are looking at a one-of-a-kind bed in the emergency room at Hartford Hospital. It's in the Purple Pod. There's tempered glass in the windows and covering the television. There are no electrical outlets in the room. A camera monitors the patient 24/7. And all the security measures blend into the room.
The patient's on edge already. It's hard to make sure you get a thorough evaluation. They may be saying things just to get out of the room, to get out of that bad experience. But if we can put them at ease.
Dr. Pepper says by relaxing the patient, they can be more confident in their diagnosis. The lighting has been studied and altered in the Purple Pod. It can be dimmed and colors can be changed from yellow to blue to green.
Different colors can help a patient feel more calm and relaxed, and we really tailor it towards the patient. So if the patient prefers a blue light or a green light, we can adjust the light to their preference.
One of the biggest problems is dignity. When you take 4, 5, 6 patients and put them all in the same room, they have no privacy. But here, the Hartford Hospital rooms, all you do is flip a switch and it tints the glass, instant privacy inside the room.
So you can see that we have windows where we can close it down and be able to do some therapeutic counseling and give them privacy.
Right now, Hartford Hospital has 10 of the new rooms in the Purple Pod up and running, and there are 13 more that will be done next month. These state-of-the-art, one-of-a-kind rooms in Connecticut are leading the way to changing the way behavioral health patients are treated.
It allows us to have access to the patient and allows the patient security and a calm, quiet environment.
And Hartford Hospital can see between 10 and 20 patients a day that go into the Purple Pod. Sometimes they see as many as 30 to 34. Those new rooms are needed. I'm Bob Wilson reporting live in Hartford, News 8.
And the state is moving forward on the mental health issues concerning new laws passed following the Sandy Hook shootings. Chief Political Correspondent Mark Davis takes a look at what is on the table.
There seems to be a general consensus among the professionals that universal screening of kids for mental health issues is a necessity, and that waiting to do it when they are in school is too late. Michelle Chase is the mother of two, one with special health needs.
We tend to act when we're in crisis, when children are entering the juvenile justice system, pretty much when it's kind of too late.
Today, mental health care experts and workers from across the state gathered to launch the third part of the massive change in laws prompted by the tragedy at Sandy Hook. The now obvious mental health instability of shooter Adam Lanza and addressing that kind of problem may be the most difficult part. Ellen Forbes is also a young mom.
The birth to 3, they have that great window because when they say your development between 1 and 3, that's your personality, that's where you learn your life view, and it's very true.
It's extremely important because if we're able to identify the fact that when the child's exhibiting these serious behaviors, we're able to provide the services.
Another serious issue is that many insurance plans do not cover mental health treatment. So even if it's diagnosed, some families can't get the services. The governor said today that he would be willing to support more mandates on the insurance companies for this. But in the case of Adam Lanza, just a look at his mother's home tells us money was not an issue. The police report indicates she withdrew him from early treatment.
Perhaps Mrs. Lanza didn't feel properly supported in the community. Perhaps some of the terminology that was applied to her child in school or elsewhere turned her off.
I'm Mark Davis, News 8.
These public forums will be conducted in cooperation with Yale and will be held all across the state with the goal of having a plan of new action ready by October.